Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Reni. For this moment, I want to present my article. The title of my article is "The Effectiveness of Modified Spark on Children Anxiety Assessed from Development Study." My team in this research is myself, Reni Marita, Suryo Ejiono, and Indri Krisvianti. For introduction, SPALK or spleen is tool used to prevent bone deformity, stabilizes the infus from shifting, prevent the movement of if there is a fracture. This picture shows us that the SPALK can use to stabilize the infusion from shifting, and he can make hand is stable. Spalk undergoes change in the shape according to the time and continues to change. This change can be accepted as a scientific development. Spalk with a new motif can also add a new atmosphere by giving the child the motif that is desired by the child. Giving this motif is proven to reduce the anxiety of the child being on intravenous therapy. On preliminary studies show that of 20 respondents. From the 20 respondents, show us that the 14 respondents were suffered anxiety and 6 respondents are moderate anxiety. They all of them in a hospital, and they all of them get intravenous therapy. The picture shows us that the spalk developed from the time. In the first time, spalk just from cause, and then develop with a modified motif, and this picture show that the spalk used in the hands of a patient. The purpose of my research is to determine the effectiveness of using pattern spark on the level of anxiety in children who have an intravenous therapy in children ward in a hospital. The method of this study. The method used in this study was a quasi-experimental study using two groups of pre and post test, with the control group and the intervention group. Respondents in this research in this study were 52 child respondents. The technique sampling we use is a purposive sampling technique. To measurement instrument used to measure the level anxiety, we use CAS. CAS is a Spanish Children Anxiety Scale. This is exactly for client with 1 until 6 years old. Except that we use the observation sheet too. The result. This is the result of my research is there are a significant effect of the level of anxiety of the child who is given. The act of using SPALK is pattern in the intervention group with the p-value is 0.0. For the last, the conclusion. That my research showed there was a positive affection of children who were attached with the pattern SPALK. The children look so happy, and the anxiety decreased compared to the children who only wore plain SPALK work in cause. I think enough for my presentation. I'm sorry if any mistake. Assalamualaikum warahmatullahi wabarakatuh.